Hi, everyone. To those who are watching live and to those who are watching on recording, welcome. And thank you to SoMeDocs for this opportunity to present something that I am so very passionate about. So you're looking at the slide and thinking, mental fitness, what the heck is that? I'm sure you've heard about physical fitness, but mental fitness, most of us really haven't heard about it. So today I'm going to talk to you a little bit about what mental fitness means, why it is important to us as physicians, specifically for us as women physicians, and how you can start developing your core mental muscles. Because just like in physical fitness, you have to develop your biceps, your triceps, your quads. In mental fitness, we develop mental muscles. So, why do we need to uh, become mentally fit? And it says over here, right, to achieve professional development and personal fulfillment. So, as I go through this lecture, you are going to understand why this is so important for each and every one of us. Now, who am I and why should you listen to me? My name is Asha Padmanabhan. I am a board certified anesthesiologist working full time clinically. I am a physician leader in several leadership positions, both in my hospital, in the Society of Anesthesia, both at the state and national level, and local communities. And I'm also a master certified physician coach and a positive intelligence coach. So, why should you listen to me? Okay. So, like many of you, it's been a hard couple of years during the pandemic, and it took a toll on all of us. It really took a toll. And for the first time in my life, I realized how vulnerable I was, even as a physician. And I learned job insecurity because that was the time when we were facing cuts. Physicians have never faced that before. We were facing cuts. And even though our work was not any less, in fact, we were working more, yet even in my own company, we had pay cuts and all of us faced that. Apart from all of that, the pandemic really took a toll on us as women physicians because we became more of the caregivers. So apart from work, now we also had added responsibilities at home, and yet the work did not finish. So what happened? Our challenges grew, and uh, the compensation for that, whether in time, money, whatever it was, it never grew. Okay. So through all of this, I kept hearing more and more women physicians talking about how unfulfilled they were feeling, how burnt out they were feeling, and how they wanted to quit medicine. And I identified with that. And I realized early on during that pandemic that I had a very short runway in my career if this carried on. And I needed to do something to change that. I needed somehow to rekindle my joy in medicine because even though I was in all these leadership positions and I loved being in those positions, yet there was that source of discontent. And the external world was not likely to change. So the change had to come from within myself. And at that point was when I got introduced to coaching and subsequently to the concept of mental fitness. What I discovered through the mental fitness framework and through the coaching had such a profound impact on me on all areas of my life. I went into it for professional fulfillment. I came away from it understanding and realizing that it had an impact on my life, on every single aspect of my life, from my family, from parenting, from well being, from feeling professionally fulfilled. So, this is where I really truly understood the importance of it, and which is why I am now passionately sharing about this with you guys here who are listening to me here or who are listening on the recording. So, how to thrive in challenging times, and what does that have to do with mental fitness? What does that mean? So, you just heard my story, and so if you are here to ask me, how do I feel more fulfilled at work? How do I feel happier? How can I be more productive with what I have, with the constraints that I have at my workplace, whether that's in my own clinic or in the hospital or employed or however your practice runs? How can I feel more fulfilled without sacrificing more of my family time? Because I have several clients who say this. I know I can do more. And I know that when I started out in medicine, I had all these grand plans, yet now I'm feeling stuck because now I have a young family and I don't want to sacrifice, but I still feel unfulfilled. So you're in the right place because I'm going to share with you one framework, one operating system, one mental operating system, which will help you with all of those things. And that operating system is called mental fitness. So the goals of today are, for the first is for you to understand what exactly mental fitness means. And then you will learn what the basic muscles for mental fitness is. Like I said, it's not just exercising your biceps or your triceps. There are three core mental fitness muscles. And that makes it so easy because there's only three you need to focus on. The next thing is you will learn how being mentally fit can lead to peak performance, to professional and personal well-being, because we are not just physicians, we are a whole person and we need to feel fulfilled, not just professionally, but personally, for us to be happier at our work and wherever we are. And lastly, you will learn how you can achieve mental fitness. So what is mental fitness again, and why do we even want to work on it? There are two main reasons that I am going to really focus on today for the purposes of my audience here, for you guys, and that is professional development and personal fulfillment. So I talked a little bit about this, is that we had not just during and after the pandemic, but even before that, we have had so many barriers to our professional success. One key thing I found from being in leadership and from coaching women physicians is that we feel this profound lack of leadership skills because we were not taught in medical school and residency how to be leaders. We were taught to be great clinicians, but that never went into how can you manage a team. Whether you're in the hospital, how do you manage your peers, the staff that you work with, or if you have your own private practice, your MA, your scribe, your nurse, whoever works with you, we never learned how to effectively communicate with them. How do we deal with conflict? Because even though great clinicians, we did not have the skills. Now, some people are born with the skills. Most of us are not. Most of us have to learn them. And that's a good part, is that all of these skills that I'm going to talk about are completely learnable. So one of the barriers that I found to professional fulfillment was feeling that you lacked some of these skills, so then you would not apply or put yourself forward for some of these positions that you really aspire to. You knew you could do it, but you felt the lack of these skills, and so you could not apply, right? So lack of leadership skills is one of the barriers that prevent us from feeling really fulfilled and from achieving our full potential. Now, research shows us that we need to develop 5 key leadership skills or competencies to succeed as leaders. You must have heard about emotional intelligence. That's a key skill for all leaders to have, even including all physician leaders. The second one is self-awareness, the understanding of your own strengths and your weaknesses, and how once you understand them, you can avoid those blind spots and find the appropriate people who can help you. But without self-awareness, that cannot happen. The third is conflict management. And this is something that I find a lot of women physicians shy away from. We run away from conflict for various reasons. And this is one of the skills we need to develop. And again, luckily, these are things that we can learn. And then decision-making skills, of course, you need to have that. And finally, the how you're going to influence other people, building influence. Because as a physician leader, whether you have a title or not, even as a leader of your own practice, you need to be able to influence the people around you so that the decisions that you make for the good of your practice can be carried out. So that is one of the things that I'm focused on. The second part is burnout. We talked a little bit about this in the beginning, but at the core of all we do, of everything we do is the desire to feel happy and fulfilled. And you'll all agree there's plenty of data out there, especially now after the pandemic, that women physicians are emotionally exhausted. You can call it burnout, you can call it moral injury, whatever you need to name it. This is a huge problem. And I've seen figures of even like 64% of EM docs reporting burnout, 57% of, in general, physicians reporting burnout. And this is bad because burnt out physicians leave practices. This is not what we need to happen. So how then do we go from this picture here, where we are burnt out, we are feeling unfulfilled and unhappy, to this picture here, where we are now wanting to feel happy, we are fulfilled, we want to go to work, we are not thinking of quitting, and whatever our day brings, we are able to face those challenges. Because as you know, challenges come in various ways every day. It could be small or big, but our ultimate goal is to be able to feel that we can meet those challenges without extreme stress. And here is where the concept of mental fitness comes in. So, to define mental fitness, and from here on, what I'm talking about is a lot of the work done by Shirzad Shamin, who is the founder of the Positive Intelligence Program. And I'm happy to give you all the references at the end of this. So, mental fitness is defined as your capacity to respond to life's challenges with a positive rather than a negative mindset. Now, when I first heard this sounded very woo-woo to me. We are physicians. We want data and research. So when I first heard this, it sounded like, oh, you've got to start thinking about everything in a positive way rather than negative. And that does not sound doable, nor does it sound as something that I wanted to do. But bear with me as I go through this talk, you will understand what this actually means. So how do you respond to life's challenges in a positive way rather than in a negative way? When I saw what the study showed on the impact of this, which is increasing your peak performance, which is what we talked about, increase well-being and healthy relationships. And this is, again, both at work and at home. So this was the impact that was shown. And for all of us nerds and physicians out here, this is key. This is all research-based. This is breakthrough research in these four fields of neuroscience, cognitive behavioral therapy, performance science, and positive psychology. So all of this is research-based, and the research comes from hundreds of CEOs, their executive teams, Stanford students, world-class athletes, and over 500,000 participants from over 50 countries have taken part in the mental fitness programs, and that's where the data comes from. And there's even functional MRI-based research, which has shown the difference. So briefly, what the factor analysis shows, this is really the key to this work is factor analysis, which shows what the root cause is. And from this work, what was shown that when you do root cause analysis on mental fitness, or how do you face a challenge with a positive mindset rather than a negative, ultimately, there's only three things that are impacting, that are the root causes of mental fitness. There are the basic building blocks of mental fitness. And that is saboteur interceptor, sage, and self-command. At this point, these terms will mean nothing to you, but as I explain it, they will start making some sense, right? So saboteur interceptor, sage, and self-command, what are they? So I want you to think about times in your life when you have heard that voice in your head saying negative things to you, either to you or to someone else. We've called that many different terms. We call that the inner critic. We call that many different names. Imposter syndrome is one. But there are so many different names that we have called that negative voice in our head. But what this particular framework of mental fitness has done is to make it very simple and to call all those different voices in our head saboteurs, because they sabotage our performance, they sabotage our happiness and our wellness. So the first building block for your mental fitness is to identify the saboteurs. And what are the saboteurs? So Unlike all these different names, what this framework does is really simplify it and make it very self explanatory. The judge is the first and the master saboteur. And this is something that we all have. And as I talk about it, you will recognize and understand it within yourself. And the judge, saboteur, and the question is not whether we have it, it's that we all have it. It's to what level we have at what moment in time. Because this judge character can sabotage you in different ways, in different times, at different levels. Some of us have the first modality to be extreme, where it's the judge of self. It's that voice in your head that tells you that you're not doing things right, or if only you did things differently, then you would succeed, or if you could speak up, then you would be better, or if you understand what I'm saying. It's that voice in your head which judges yourself. The second part of the judge is the one that judges others. And how many times have you looked at a coworker and said, "Oh, if only that person was nicer, we would be able to work together better." Or if that MA was a little bit more um, enthusiastic, it would make your work much easier. These are voices in our head which happen all the time. Think about an interaction you've had, a conflict you've had, and think about what the voices in your head were saying at that moment in time. And when you do that, you'll understand why that saboteur, that judge of the other, is such a key uh, figure in sabotaging the relationships you have. The third modality is something I had not thought about and I had not recognized, and that is the judge of circumstances, the judgment of situations. Think about it. How many times have you told yourself, "I would be happy if XYZ happens. I would be happy if I got into med school. I would be happy if I got into a good residency program. I would be happy when I got a job." So, all of these times, you are putting that onus of happiness into a situation in the future. But when you get there, think about it, when you got into med school, or when you got into that residence you wanted, or that job that you wanted, how long were you happy? Did it take, how long did it take for you to set your next goal that told you, okay, once I become a partner, I'd be happier, or once I start seeing 40 patients a day, I would be happier. So that is something that I want you to recognize as well, is the judge of circumstances. So again, the question is not which judge saboteur we have. We all have it, and each of these plays up at different times and different strengths. Now, if only we had the judge saboteur, then we would be able to recognize and move on from it. But this judge character, he works together with a bunch of other helpers. We call those the accomplice saboteurs. And these together are the ones that sabotage your happiness, our success, because there are these other voices in our head. And again, the framework makes it a little easy to help you understand what they are with the names that have been given. Now, these are the accomplice saboteurs, and they are different ones like the hyperachiever, the hyperrational, the victim, the stickler, the controller, the victim, the avoider, and so on. And as I say the names, I'm sure you recognize some of them that come through for you, the restless as well. And it's not that all of us have to focus on all of these saboteurs. For each of us, two or three of them are predominant, and that's what we focus on when we focus on our mental fitness training, is figuring out which ones are dominant for us so that then we can work on muting them or stop them from derailing us. And on the opposite side of that, on the opposite side, if we have the saboteur, we also have our wise inner selves, our sage, which works towards making us feel positive and helps us succeed, and is associated with all the positive emotions we have. And the sage, our wise inner self, has 5 different powers that help us do that. And those are empathy, curiosity, activation, and passion, and purpose, and innovation. So for the negative, we have the positive. So the mental fitness training focuses on muting these saboteurs or making them weak and then making our sage power stronger. So at this point, it's probably all still woo-woo, but as I go through, I hope that you will get a little bit more out of this. So it makes it very easy. We have a very simple assessment that tells you, it's a 5 minute assessment that tells you which ones are your major saboteurs. So you can see my results from here. My avoider, saboteur, my hyperachiever, and my stickler were top of the line and absolutely played a huge part in my unhappiness. So my hyperachiever is, and I have to say, most of us physicians are hyperachievers. In fact, it seems to be a disease of in the US where we are all looking for our next goal. So we set out a goal, we set out towards achieving a goal. No sooner do we achieve it, then we want to go to the next one, and we go to the next one, and we go to the next one. No matter, I mean, not taking the time in between to really enjoy the success and be happy in it. So this is a very brief way of how my hyperachiever has been sabotaging me. And the other one is the avoider, where the avoider saboteur really tells you that it is good to keep things even keel. So so I tend to avoid conflict, or I tend to avoid things that I need to do. And it took me a while after I went through this mental fitness training to understand and recognize how much these saboteurs were derailing me and how much they were sabotaging my success. The key thing here is these saboteurs actually do help you feel like you achieve things because of them. Like my hyperachiever was very strong in telling me that it was only because of me that you have achieved so much in life. All those titles that I have achieved are because of the hyperachiever. What it doesn't tell you that is that it's a lie, because it does it. I wasn't happy when I achieved those. So that is the lie of the saboteur. So the now that you understand what the saboteurs are and what the sage powers are, this is how they work. The saboteurs, and this research is again, I can provide that for you. The saboteurs work through negative emotions. They motivate you through negative emotions, through anxiety, through fear of failure, anxiety that you're not doing well enough, um, all the negative emotions that you can think of. Whereas the sage powers flip the coin, and the same thing that you want to do, if you do it through your sage powers of innovation, you might be able to achieve far better results. And let me give you an example. So if I am applying for a position, my judge saboteur is very dominant and tells me, A, I don't have the qualifications, B, they don't need someone like me, C, what is the point of even trying, because they are not going to pick me, and I need 100% of my the qualifications. So my judge is strong, but maybe my hyperachiever comes in and says, no, you need to do this because that is the next step for you, and you need to show yourself that you can succeed in this. Otherwise, it's not worth it. If I flip that coin and come from the sage perspective and look at the position and what it is that I can bring to that position, I will start looking at my strengths and start looking, instead of focusing on all my negatives, I will now start focusing on what is it that I can achieve, what is it that I can bring to that position, and know that even if I fail, I will still learn something from it. And so then I'm applying for that position in a more positive framework rather than being pushed towards it by my judge and my hyperachiever. So this brings up the question that negative emotions, are they good for you? Because yes, my hyperachiever can tell me, if you don't succeed in this, then you really are not a good leader, and then push me to do that. But is that really good for me? And my hyperachiever is going to tell me that's good for me. That's the lie of it. So let me tell you something. Let me ask you something. Is pain good for you? So when you put your hand on a hot stove, what happens? You touch it and you pull it away because that pain is telling you that that's something wrong here, that you're doing something that is hurting you. And it immediately sends a signal to your brain to pull it away from that hot stove. So pain is absolutely good for you. But what is different is how long is pain good for you? What if you keep your hand on the hot stove for longer? Is that good for you? No, because you'll end up with a burn. So, why, if you stay in negative emotion, how is that going to be good for you? If you stay in anger or frustration or disappointment for a prolonged period of time, how is that going to be good for you? It is not. So, negative emotions are good for a 1 second signal to show you, to alert you that you need to pay attention here and then you need to do something different. Because staying in that negative emotion really impacts your ability to think through a solution in a better, calm, clear headed, laser focused way. Because if think about the number of times if you've been in a conflict, right? And this happens with me all the time as an anesthesiologist. We have conflicts at work with the surgeons all the time. We have tussles. Now, if I get into an argument with a surgeon and I spend the next rest of my day being angry at him, being annoyed, it impacts the rest of my day. On the other hand, if I notice that negative emotion and understand and realize that it's not doing me good and do something to shift into a different framework of mind, which is how the mental fitness helps me, then I do not spend my day in that negative emotion. So if we have the saboteur, we also talked about the sage power, which is our inner wisdom. It's a wiser inner self that looks at stuff, that looks at things, and this is the part of the brain that is associated with all the positives. Now, this has actually been shown on fMRI, by the way, that all the saboteurs, they live in the left brain, where the sage lives in the right brain. It is in that part of the brain which is associated with the positive emotions and like the previous slide showed in the different parts of the brain. And what is the sage perspective? The sage perspective is that every outcome or circumstance can be turned into a gift or opportunity. Now, you might look at this, and the first time I heard this was again, I didn't identify with this. I mean, obviously, there could be many examples of where something bad happened, and how could I even look at them in a positive way? But then I started thinking back to all what I considered negative situations or circumstances in my life. And as I looked at it, I found that each of them had turned into a positive. For example, when I was in my private practice as a sleeping partner, and then the managing partner left, at that moment or on that day, I remember it was so sleepless that night because I couldn't figure out how we would survive, how we would make payroll, because none of the rest of us had any idea about the finances of our company. And so I felt like I was letting down the entire team because I had no idea about the finances and how would we make, like I said, payroll. And that pushed me into stepping into that role of treasurer completely unprepared, learning all the finances. And that became the first stepping stone to the rest of my leadership career. So in the moment, it looked like it was a disaster. But from the gift of hindsight, that was one of the best gifts that I could have gotten. The second time, when I was asked to step down from a leadership position, I went through hell where I was questioning myself, questioning my capabilities, questioning my leadership. And now looking back again, that was one of the best things that could happen to me. Those are big things, but even little things in your day to day, right? One of my clients, her MA wasn't performing as well as she wanted, but she was afraid that the person would quit because then how could she manage? As we talked through this and looked for the gift and the opportunity in it, she understood and realized that maybe this was the right time to take action and look for better people, for better candidates for that position. And then she ultimately found that letting that person go and finding someone more suited to her practice would actually work. And again, big things, but even little things day to day, the sage perspective is that every outcome or circumstance can be turned into a gift or opportunity. Now, there may be some skeptics who will take the death of a loved one and say, how can that ever be a gift or an opportunity? And I could give you examples, but we're not going to go there because that's 99% of the time we're not talking about those extremes. So the sage perspective is that every gift, every circumstance or outcome can be turned into a gift, an opportunity. So which perspective is true? Your sage, your saboteur says, this is bad, 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 bad. Whatever is happening, this is bad. I lost my job. This is bad. I lost a patient. This is bad. The sage says, this is a gift. And the answer is whichever you believe is true. If you believe the saboteur, that is true. If you believe the sage, that is true. So now, how is this helping you become mentally fit? So we found out what our saboteurs are, we found out what our sage is, but how do we shift from one to the other? And this is where the third step of that mental framework, the third muscle comes in, and that is the self-command muscle. So the way you build your self-command muscle is through reps. It's like when you build your biceps through biceps curls, you're doing reps, right? So mental fitness, your mental muscle, self-command muscle is built over time through PQ reps. And these are 10-second PQ reps. Now, if you're with me here live, then I'm going to ask you to do this with me, or when you listen to this recording, do this with me, and you will see how you shift. So close your eyes. Take a really big, deep breath. Inhale. Release. Now rub 2 fingertips of your hand with such attention to detail that you actually feel the fingertip ridges on both those fingers. Rub it with such attention that you feel the fingertip ridges. If you've been following along with me, open your eyes. That was just a 10-second PQ rep. And PQ reps can be done with sound, with touch like we just did, with breath, and so on. And these are ways for you, these are ways for you to get out of your saboteur thoughts and drop into your sage self. And what research has shown is that as we build this mental muscle through PQ reps, neural pathways start shifting from our normal reactionary pathways of how we respond to a stimulus into a different pathway where we are now channeling it into the sage. So the simplicity of this operating system is that if you're feeling negative emotions, that is, you are in saboteur mode, you stop, you do some PQ reps to quieten the saboteurs, and you switch into the sage brain. And then you use the sage powers to find the solutions to your whatever conflict you're having. So then the question is it really possible to just shift from saboteur to sage even in tough challenges? And the answer is absolutely. But how quickly you can do that depends on how strong your mental muscle is. And that is the whole framework of building that mental fitness. Because what happens is that lasting change requires not just insight, which is what you're getting here. You're getting insight into an operating system in your brain, but without practice, that is not going to help. So you can read all about riding a bike, but until you actually get on that bike and pedal, you will not be able to maintain that. So this building mental muscle comes through using those PQ reps, and that's as the framework suggests, it requires intense initial practice. Now, intense for us really it means 15 minutes a day. It's just 15 minutes a day, and that's how you start building your mental muscle. So the mental muscle building is through the PQ program, which is the Positive Intelligence Program, which is through the Women Physicians Accelerator program that I have. But the next steps for you as we talk about mental fitness is for you really to understand what it means for you, to figure out what are your saboteurs, how are they sabotaging you. So you can actually do your own assessment. And if you would like, you can schedule a complimentary call with me where you can go through the saboteurs and we can figure out how they are sabotaging you, and then change that, become mentally fit so that as you build your mental muscles, you're able to increase your wellness. And how do you do that? You are able to communicate better. So, for example, you're in a conflict situation, you recognize that your anger, your frustration in when you're shouting at that other person is a trigger. It tells you that you're in saboteur mode. So once you recognize that, the anger, the negative emotion has given you a clue that you are in saboteur mode. And how long you spend on it depends on how much mental muscle you've built. But if in that moment, as you're staring at that person, you're doing PQ reps, either you could be rubbing your fingers while you're looking at him, if you're or her, you could be doing that, and you kind of center yourself and give your brain that time to shift into maybe empathy, maybe curiosity. Why is the surgeon yelling at me that this case is delayed? Maybe it's because he is or she is worried that he's going to miss his kid's pickup today, or he's worried that if he cancels this case, this patient's not going to come back right now. My brain is not going to allow me to go there into that positive curiosity part when it's sitting in the negative anger and frustration. And how dare he tell me that I need to do this case right now? My brain will only be able to shift when I'm able to recognize that negative emotion and to use my self command and PQ reps to shift into a different empathetic or curious frame of mind. So I'm going to stop there and open it up to Q&A if you have any questions.